If I had to come up with 5 reasons why I would never get clear aligners, it wouldn't be that hard. This video should be helpful for dentists and patients alike, so that way everybody can get an idea of how patients view the treatment. Full disclosure, I'm a dentist and I actually do a lot of clear aligner treatment on my patients, and I think it's an excellent treatment option. However, that's not the point of this video. So without wasting any time, let's dive into the biggest reason why I would never do clear aligners. Cost. Clear aligners, you know, the plastic that you put on your teeth that moves them, they're not cheap. On average, the price of clear aligners is $5,000. And I can tell you right now, I don't have $5,000 to spend on plastic in my mouth, but I do have $5,000, and I would rather spend that on things like a nice trip to Lake Como in Italy, or new clothes, or maybe even some nice food, you know, like maybe some omakase, some sushi. Does that sound like things that you want to spend your money on? You see, the issue here is not the $5,000 price in aligners. The problem is the priority of all the things I listed, right? You have the money at the end of the day, but you choose how you want to spend it. The trips, the clothes, the food, those are things that make me happy right now. Plastic on my teeth doesn't really make me happy right now, and it isn't a priority. Now, the sticker shock of $5,000 in one go can be daunting. I get that. But the good thing about aligner treatment is that it's not instantaneous. It takes time, usually around like 6 to 8 months. So naturally, you can break up the payments, so that way it's not just one payment of $5,000. Some offices even offer extended payment plans, and you can break those payments up over 2 years if you'd like. So think about it. You can do $5,000 treatment broken up over 24 months for as little as $200 a month. That's pretty doable. I know you have $200 a month that you can spend. So you have to ask yourself the question, is it worth it? Is paying for this treatment going to improve my life in any way? That's all we want, right? To buy things that make our life better or more enjoyable. The trips, the clothes, the food, those are all sources of instant gratification. Plastic on your teeth is a source of delayed gratification, because during treatment, it's not as enjoyable as life is going to be after you're done with treatment. Those lasting benefits are going to be there for you for the rest of your life. That's what you're working towards. You will actually save money over time by investing into clear aligner therapy now, because you will have less dental problems requiring less dental procedures in the future. Straight teeth are naturally more inclined to be healthier and require less expensive work. They're also easier to keep clean. So when you keep your teeth clean, you'll have less problems. It will cost you less money to maintain. It's that simple. Okay, second reason why I would never get clear aligners is because of discomfort. Clear aligners can be uncomfortable to wear for some people, especially during the first few days when you're wearing a new tray. Teeth are being moved in your jaw. Does that even sound like it would be pleasant? Some people I know also will experience some irritation, maybe some soreness in the gums or the tongue, just due to having plastic on their teeth. And that's something that I would not sign up for. I would rather have crooked teeth, smelly breath, bleeding gums, and have to get a deep cleaning a couple times a year, where the hygienist just scrapes the roots of my teeth every 3 months, and have my floss break every time I try to floss, and have my teeth chip and break down over time. I would rather have that than wear plastic on my teeth. It's definitely more enjoyable, right? Okay, so again, you have to weigh these options out. Would you rather tolerate short-term discomfort to get long-term improvement? Or would you rather keep status quo right now while you're young and deal with all these problems and more severe complications when you're over? Look, I'm not a fortune teller, but I do see patients of all ages. And almost every single one of them that are over the age of 50 say they wish that there was something they could have done to prevent the problems that they're experiencing in their 50s when they were younger. The thing is there weren't that many options for them when they were younger to prevent the problems that they have today. That's not the case for you. So you don't really have an excuse. You have a choice. Are you going to choose to improve your life, or are you going to suffer the consequences of sitting around doing nothing? Real quick, if you're enjoying this video or finding any value, please drill that like and subscribe button. Okay, so what is the #1 predictor of successful clear aligner treatment? Commitment. Clear aligners require a significant amount of commitment from the patient. There's no getting around this. You have to wear the trays for 22 hours a day. It's pretty much all day. You're taking them out whenever you eat, and you're brushing and flossing every time you put the trays back in. That's not an easy task. So commitment makes my list for the 5 reasons why I would never get clear aligners, because as a patient, I have commitment issues. I can't commit to anyone or anything. Okay, I'm kidding. My wife and I have been together for 13 wonderful years, and we are happily committed to each other. But plastic in my mouth, that's too much. I can't even wear a night guard when I sleep. Does this sound like you? So if it does, to that I say, if you can't see yourself wearing trays for 20 22 hours a day, I don't recommend clear aligners. See, because if you don't wear the trays, the teeth are not going to move. It's that simple. You have to wear the trays for the treatment to work. If you don't, how do you expect your teeth to move? Magic? So look yourself in the mirror and ask yourself, can I commit to wearing these trays for 22 hours a day until we're done with treatment? If that answer is yes, go for it. If you're unsure, then you need to look yourself in the mirror and spend some time and reevaluate. Why are you signing up for the treatment in the first place, right? What are you trying to get to? See if that why is strong enough to make you want to commit to doing something in the short term to get that long-term benefit. To my dentists out there, if you're watching, please do not push clear aligner therapy onto every single patient. It's not for everybody. That's what makes it great. If your patients aren't committed or aren't willing to commit or not able to commit, don't make them do the treatment. Oh yeah, docs, if you're wanting to start offering clear aligners to your patients and you don't really know where to start or what to do, I made a free training for you that you can check out, and it'll help walk you through how you can start 3 more cases tomorrow with your patients. The link for that's in the description below. Be sure to check it out. Okay, back to the reasons why I would never get clear aligners. Reason number 4 would be discipline. If you're thinking, I don't have any discipline, aligners are not for you. To achieve the desired results, clear aligners require strict adherence to the treatment plan. So not only do you have to wear the trays for 22 hours a day, but you also need to take care of your trays and your teeth during this process. You see, because if you don't clean your trays, they're gonna get gross, they're gonna get smelly. And when something is gross or smelly, how likely are you to put that in your mouth? Probably not that likely, right? So if you're not that likely to put something in your mouth, how effective do you think the treatment is gonna be? Probably not that effective. So this is why discipline and having a routine to taking care of your trays is super important. And one easy way to do this is to just make sure that whenever you take your trays out before you put them back in, at the very minimum, rinse them with water. This helps kind of dilute the saliva that's on the trays, and then you can have your meal, brush and floss your teeth, and then put the trays back in. You know, maybe if you want, you can, like while you're eating, you can have the trays soak in some water with like an aligner cleaning tablet. That can help. You can also brush your trays with your toothbrush. My recommendation though is don't brush your trays with toothpaste on your toothbrush, because the toothpaste is actually abrasive. So that will actually create micro pores in the tray, which can then attract plaque and staining to really coat the tray. So it can make it worse. So that's a good tray cleaning protocol to follow. The goal of clear aligner therapy is to improve your oral health, right? So this is a huge benefit of clear aligners over metal braces, because while you're moving your teeth, you can actually maintain, if not improve, your oral health. You can't necessarily brush and floss as effectively with metal braces compared to aligners because you've got brackets and wires all over your mouth. So don't miss out on this opportunity to keep your teeth clean and improve your oral health. Honestly, my patients who are committed to treatment, they actually come out of clear aligner therapy with an improved status of oral health. This is amazing because now they've created such positive habits around keeping their teeth clean. And I love clear aligners because they act as a great accountability partner for patients. Has your dentist ever told you to brush and floss your teeth every day, but you still don't? With clear aligners, you can improve your oral health because this is your built-in accountability partner. Okay, all of this brings us to reason number 5 as to why I would never get clear aligners. Importance. Investing in my oral health is not important to me. I know why people value it and I know why it's good for me, but I just don't care about it. If this is you, you're not alone. I don't mean that in a good way. I'm just saying there's so many people out there in the world who don't give a damn about their oral health. They don't think it's important for various reasons, but I can assure you there are more reasons as to why it is important than not. But I can't dictate how you think or what you feel is important in your life because you're an individual and you are the only person who can dictate how you live your life. All of my dental colleagues encounter patients just like you on a daily basis, and it's a shame. We are trying to help you improve the health of your mouth. But what I've quickly realized is that you cannot help someone who doesn't want your help. We offer education, we offer treatment options, we offer guidance. But at the end of the day, if you don't want it, you won't get it. I say that because the opposite is true. If you truly want something, you will do anything and everything to get it. You will learn about it, talk about it, analyze it, save for it, justify it, and eventually you will get it. So I hope you found this video helpful in realizing that clear aligners are not for everyone. But if you feel like you're up for the journey and you want to take your oral health to the next level, clear aligners could be a great treatment option for you. Find yourself a dentist who is ready and willing to support you on this journey and level up. Thanks for watching this. Once again, share this with anyone you think may benefit from it. I hope you enjoyed it. I'll check you out in the next video. See you there.